Today I'm going to teach you a skill that could save someone's life. My name is Chase Perrins, and I'm going to teach you how to do effective chest compressions. Our lesson objectives today are to understand the goal of chest compressions, just what we're trying to accomplish, as well as the mechanics and the process of how we're going to achieve that goal. At the end of the lecture, I'm going to put these skills together and combine them into a demonstration showing you how to do effective chest compressions. First and foremost, it's important for us to understand what our goal is. What is the goal? Why are we doing chest compressions? Down and dirty, the most basic sense, we're doing chest compressions to pump blood and oxygen to the person's brain and other vital organs. After just 6 minutes without oxygen to a person's brain, they'll experience permanent deficits. That's why it's important for us to get on chest compressions early and do effective chest compressions when we do them. So how do we do effective chest compressions? It's extremely important for us to understand the mechanics of the process, the mechanics of what we're doing. How are we pumping blood and oxygen to a person's body? I think this is extremely under-taught in CPR classes today, so I'm going to spend a few minutes giving you a great understanding of the mechanics of this process. What we're actually trying to accomplish is compressing the heart between the person's sternum and their spine. It's kind of a brutal concept, but it's extremely important for us to understand what we're doing and how we're trying to accomplish our goal. If we don't have enough depth in our compressions, we're not going to compress the heart enough to force blood out and pump blood to the rest of the body. If our compressions are too fast, we don't allow the heart to refill with blood after each compression. And if our compressions are too slow, then we simply don't pump enough blood, enough oxygen to the body. So understanding this process is extremely important in the mechanics of it. I've got a slide here that shows a person doing chest compressions and doing just that, compressing the heart between the sternum and the spine. My next slide is a CT scan. It's a little bit better view, but you can see the heart in the center of the scan, the sternum's at the top, and the spine's at the very bottom. This just gives you a good idea of that concept. When you're doing chest compressions, you've got to really squeeze that heart. It takes a lot of force and pump blood to the body. So how much force? What's too fast? What's too slow? What kind of rate should I use? These are all questions that are extremely important, and I'm going to answer them now. When we talk about depth, what's an adequate depth to compress the heart enough and force blood to the body? American Heart Association says at least 2 inches. If we compress at least 2 inches of depth with each compression, then we're adequately pumping blood through the body. Less than 2 inches and we're not compressing the heart enough to actually force blood out. It's important for us to understand that, and having an understanding of the mechanics, we understand why this is so important. The next important number to remember is the rate. I explained earlier why too fast is ineffective and too slow is ineffective. So what's a good medium? Well, once again, the American Heart Association says 100 compressions a minute is the adequate effective number of compressions to effectively distribute blood to the body without having a rate that's too fast or too slow. So 100 compressions a minute is kind of an arbitrary number. How are we supposed to remember 100 compressions a minute? How do we know if we're going too fast or too slow? Those are all great questions, and I'm going to give some answers and some simple, quick guides to how you can make sure that you're keeping a pace of 100 compressions a minute. I'm going to give those in just a few minutes. First, I'm going to talk about proper hand placement, because it's important. A lot of people don't know, well, where exactly are my hands supposed to go on the chest to do compressions? It's extremely important, but it's also extremely simple. On the slide here, I've got a CPR mannequin, and I've labeled it with the proper hand placement. You can do it right now where you're sitting. Take 2 fingers, follow them up your rib cage to the very top of your rib cage. This is called your xiphoid process. You take your other hand and you place the heel of your hand just above the xiphoid process over the sternum. That's going to be your proper hand placement. Combined with that, you're going to interlock your hands, and your shoulder position is going to be directly over the placement of your hands with your elbows locked. And I'll demonstrate that later. It's really easy to find. It's marked with the oval on this mannequin in the slide. I told you I was going to give you some quick, easy reminders of how to know 100 compressions a minute, a tune or a beat to keep in your head, and a really good one is the Bee Gees, Staying Alive. Everybody knows that tune, everybody can remember it and play it in your head. You can even sing it out loud while you're doing it, but it's exactly 100 beats a minute. You might not remember the Bee Gees while you're doing chest compressions, or it might not seem like the most appropriate tune, so there's another tune that's equally, it's also 100 beats per minute exactly, and it's very effective. It's a little morbid, but I don't really care too much. If it helps you remember 100 beats per minute and it helps you do CPR more effectively, then that doesn't bother me. And that tune is Another One Bites the Dust. If you just remember that beat in your head, bump, 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 another one bites the dust, that's exactly 100 beats per minute. You can even sing it out loud while you're doing it, but it'll keep exactly 100 beats per minute. It's important to do that in order to have effective chest compressions. So like I said, a little more morbid, but if it's going to help you do it right, I don't really care. You can use that tool and it'll help you do better chest compressions. Now let's take all these skills that we've learned and let's put them together. I'm going to do a demonstration here. We're going to talk about proper hand placement, how to find that placement, adequate depth, and adequate rate. I've got a mannequin on the ground here, so if you'll just follow me down. The first and most important thing for us to do is find the appropriate hand placement. We're going to follow up the line of the rib cage to the xiphoid process, and then we're going to place the heel of our hand on the sternum just above the xiphoid process. Interlocking our fingers, placing our shoulders in line, our elbows are locked, and with each compression, we're going to push at least 2 inches, and then we're going to completely remove the heel of our hand off the person's chest to allow the heart to recoil. So I'm going to emphasize that a little bit here, but we're going to do 100 compressions a minute. So in case it's a little difficult for you to see, with each compression I'm actually raising the heel of my hand completely off the chest, allowing that chest to fully expand and the heart to refill with blood. So what are some of the things we've learned today? In summary, we've discussed the goal of CPR, what we're trying to accomplish. We've also discussed in depth the mechanics and the process of that goal, as well as demonstrating how to bring them all together. I think now we're all a little bit more prepared for that emergency, and we maybe have a couple of good keys and reminders to help us make a difference in somebody else's life. Thank you.